Houston Healthcare Care Management Department does several things here at the hospital that are actually behind the scenes that no one actually knows about. When a patient comes into the hospital, we look at the patient immediately. We look to see if they meet criteria to be here, whether it's inpatient or observation. We have to notify the insurance company that they're here, obtain pre-certs. There's a difference. If a patient comes in and they meet inpatient criteria, then we just have to get the inpatient status approved and that's it. If a patient is observation, every single test or procedure that that patient has while they're here has to be pre-certed. So we may have to call the insurance company multiple times, maybe just one time. If they have an echo, that takes a call. If it's not done on the same day as another test. So it just depends on what has to be done for that patient. We also do discharge planning. When a patient comes in, we assess them and their family and talk to them just to see what needs they had at home prior to and what we anticipate them having when they're going to leave. It may be home health, it may be equipment at home, it may be where they need to go to rehab for 7 to 14 days. In the care management department, we have RNs who are the care managers, we have social workers, and all of my staff are very passionate. We do have ancillary people in the department that do just pre-certs, or we have people that do appeals for us. We have people that are just simply there where they're needed as far as doing the referrals for the dialysis or doing the referrals for home health. And we actually have what we call care manager assistants that assist us in those matters, because Medicare requires that we let you know your rights and tell you what your rights are. So we have the care manager assistants to go around the hospital, and before you're discharged, we tell you your rights that Medicare has us to inform every patient. We actually make rounds with the physicians. We are with every department in the hospital. Physical therapy, IV therapy, we talk to the lab. We facilitate whether or not a PICC line is done on a person so that they can hurry up and be discharged and the discharge isn't prolonged. So we're actually involved in the total patient care. The best way for a patient to be involved in the process with care management is to be aware that we're here to provide the services for them. To be aware that they can ask us or come to us with any questions or concerns that they may have. The discharge planning process starts when you walk in the door. We look at your initial assessment and see what your functional capabilities were before you came in. And we take it from there, looking at your medical diagnosis and seeing everything that happened to you while you were here in the hospital. We anticipate your needs, or we try to anticipate the needs that you're going to have when you leave. So it starts at the beginning and we continue it all the way through. Now, of course, the discharge plan is going to change. You may be admitted to a medical floor and then transfer to the ICU and then go to another medical floor. So your needs are going to change, but there's someone in every area to be there to assist in whatever your need and the changes are going to be. We consider ourselves as a multidisciplinary team because we work with every single department here in the hospital. We're known as the fix-it people. Everyone comes to us when they have a problem. No matter what the problem is, they feel like care management can fix the problem. And it may be a matter of a patient left here and discharged and went home and decided when they left, I can't take care of my mom anymore. What am I gonna do? And she's at home with me now. You know, some people would feel like, well, she's at home now, that's not our problem. It's still our problem because we need to help them. So we're still gonna work on trying to get them placed even when they're at home. Or patients come in and say they need help with medication. They went to the med stop and they come here and say they need help with medication. Or someone's in the emergency room, or it could be a do not resuscitate and they just want someone to talk to them about the different options. They come to care management for all of that. So I feel like we are the go-to people for everything.